This morning, a Florida doctor on the front lines of this pandemic has temporarily lost shared custody of her 4-year-old daughter because of her proximity to coronavirus at work. The child's father filed the emergency order and a judge ruled in favor, saying, quote, "In order to protect the best interests of the minor child, this court temporarily suspends the former wife's time sharing. The suspension is solely related to the outbreak of COVID-19. Joining me now is the doctor and mother going through this, Dr. Teresa Green. She's an emergency medicine physician in Miami. Dr. Green, thank you for being with us. Thank you for your work on the front lines of this pandemic. Everyone appreciates what you're doing. You're appealing the judge's order. You call it discriminatory. Why?
If I was married and I'd be, given the opportunity to go home to my child, no one could tell me that I shouldn't do that. And good morning. Thank you for this opportunity. My brother works, is an engineer, and he's building the tent hospitals up in New York, and he gets to come home to his two kids. No one's questioning that decision. And we have, good evidence that has really made me feel better in what I'm doing and sticking by, that shows that, children are minimally affected by the disease, and that healthcare workers who use proper precautions are not at increased risk than the general population of contracting the virus.
Your,
So I think it is discriminatory for a judge to tell me that I can't come home to my child.
your daughter's just 4 years old. How much does she understand about what's going on right now?
She doesn't. She doesn't. She knows mommy's sad. I had her for a couple of days before I gave her up. And I said to her, I don't know, I might not see you for a long time. And she said, "I'll see you Friday." And it was Friday. So she doesn't understand. And I really worry about the toll that's going to take on her. She there is a study. I'm by no means an expert in children's mental health, but I've been reading studies that show that children suffer significant psychological damage from separations such as these. And another thing that I sort of want to get into today, that the number one predictor of long-term mental health for minor
Mm,
children of divorce is a level of conflict between the parents.
mhm.
And usually the judge would respect the right for both parents to be present in a child's life. And I think this, was a rash decision in not allowing that without at least hearing the evidence.
I want to read you I want to read you a statement from the attorney of your ex-husband. It says, "Mr. Green and I have the utmost respect for Dr. Green's," that's used, "commitment to her critical work during the pandemic. The Green's temporary time-sharing dispute was presented before the court, and a decision was reached based on the best interest and safety of a minor child, limited to the temporary circumstances presented by COVID-19. Pursuant to Mr. Green's request and as ordered by the court, Dr. Green is to be provided future makeup time sharing for each day missed and daily video communication with the child. We will continue to pursue ways to resolve the delicate situation and believe that a result can be achieved safely and fairly." The suggestion there is that this is about the safety of your daughter. And there will be those who look at this and say, this is about the child's safety. She shouldn't be near, quote unquote, coronavirus. How were you guaranteeing, or how did you plan to guarantee that she was safe from coronavirus?
First of all, we have adequate PPE at my hospital, and I've been seeing coronavirus patients since approximately March 12th, and maybe even unbeknowingly before that. And we utilize the full PPE. We're very
Mhm.
careful. I've been practicing medicine, or training in medicine for 18 years now. I know what I'm doing. This isn't the first communicable disease that I've encountered. And yes, it is, there's fear and there's danger, and we're being very careful. I mean, the
Mhm.
whole tone at work is completely different. That we're very careful about anything we touch. And
Right.
I'm actually not at all a germaphobe. So we use everything we can. I've actually bought equipment above and beyond to protect myself and my child. And I come home, I strip down the carport, I take a shower, and the fact of the matter is, my daughter is not usually here when I'm working.
Mhm.
We have our custody schedule is set up so that I work on the days that I don't have her, so she won't be exposed, in that way. And I hope to not contract the virus because of the precautions I'm taking to spread it
Yeah.
to her.
Do you feel like you're being forced to make a choice here?
It's a really, really tough spot to be in. I do. I think that that's the decision I've been left with. I think it's, it's not fair. It's cruel
Mm.
to ask me to choose between my child and the oath I took as a physician. Like, I won't abandon my team at work or the patients who will increasingly look to me to save their lives in the coming weeks. Um, but it's torture, and I think my daughter, I want her when she grows up to be proud of me by abiding by the oath I took when I went into medicine. But I also know that she needs me now.
When do you think you'll be able to see her again?
I don't know. I mean, the judge also didn't give an end date. I, really do hope that this is overthrown, but or overturned. I'm sorry. But I really have, no certainty there. And the end of the pandemic, I mean, no one can say when that will be. And we don't really have any, it's at the discretion of this judge.
Well, Dr. Green, we're sorry you're going through this. We thank you for the work you are doing in saving lives of the front line of this pandemic, and we hope there is some resolution to this. Thanks so much for being with us this morning.
All right. Thank you very much. Appreciate it.